Ladies and gentlemen, it is with deep emotion, remembering over 10 years, 10 long years, 4,000 long nights, where a few scientists from Cadila, with the blessings, help, guidance from people in CSIR, people in Department of Science and Technology, people from the National Institutes of Immunology, that we worked together on this dream, a dream which Christian 12 years ago, with this bratish ambition which I had. If you're going to do something, can we try and address some of the worst uncurable diseases of the world? One of that disease was cancer. So I'm so happy and proud to announce the licensure and soon to be launched MyCDAC-C, an innovation in lung cancer therapy, the first novel drug for cancer management in India, significant breakthrough in management of squamous non-small cell cancer, the world's first target active immunotherapy, which improves the survival, median survival by over 40% in patients suffering from squamous non-cell lung cancer with no systemic side effects and ease in administration. So ladies and gentlemen, friends, doctors, colleagues, comrades, and friends of Cadila, I present to you MyCDAC-C. I remember very recently we had one of the convocation and WHO Director General had come and she quoted one of the Mahatma Gandhi's thing, and then I just went back. Mahatma Gandhi wrote 7 social sins in 1924 in young India, and one of them was the science without humanity has no relevance. So I think what you spoke today was actually really speaks the same thing. We have iconic Professor Advani, everybody knows him. We all have learned from him actually. She is one of our mentor, teacher, Professor Pankaj Sir. So I think I'll invite Professor Pankaj Sir to give his presentation on this wonderful drug, the new molecule, which is really going to be one of the very useful things.
I think before Dr. Pankaj Shah gives his the details about the whole new molecule, I must say that I am so happy to be here, and we are all very happy to be here and listening all the great lectures, and not only the great lectures, but you can see the passion in that. You can see the dedication in that. You can see that the whole life is donated for such a wonderful work for the humanity. And I think it is only when you have passion and dedication that the whole world can move along with you. So I think that's what we are very happy, and I'm sure with this new molecules, we should be able to enter into an era where the lung cancer may become easier to treat. Dr. Pankaj Shah.
Before I start my presentation, Rajiv Bhai, Dr. Brahmachari, Anthony, and all the people from Cadila, people from my family, that is a cancer family, and all India cancer family is in Delhi for last 2 days. And those who are fortunate to be here, they will be part of a very important occasion in the history of medicine, in the history of cancer treatment also. Let me go back to the I am icon. Indravadan Bhai, Modi ji, you are icon. You are icon for all of us. We have seen lots of things, and I have known to him. I am in touch with him for more than 40 years because my career in cancer span from 73 onwards, and I have realized the personality of this great man as a doctor at Cancer Institute, asking to get some printing for the souvenir, getting some small money for the conference, etc. But Rajiv, what you are celebrating in his memory every year, he was celebrating it in the past also. And let me tell you the story. Your father was a great friend of Professor Ganguly, and it has been shown here. When Ganguly was the ICMR director and the Indian Science Congress president, he was asked by the Murli Manohar Joshi, that time the Minister for the Science and Technology, that Ganguly ji, you have to take Science Congress to Ahmedabad. Because at that time, our CM, again Modi ji, wanted that conference to Ahmedabad. And he wanted to show that how Gujarat is flourishing, that too in 2003. For Ganguly, it was an order because his boss has asked him to do this. And he cannot deny. And because of my associates with Gujarat Cancer and Research Institute, he was having soft corner for my institute, and I was having a great regard for that gentleman. He asked me, Pankaj bhai, you have to do it. But this has to be done in a university. And I suggested that time Nirma University in 2002 was coming up. I met Vasani, I met Mr. other people, and along with the National Occupation of Health, Mr. Sayyid, GCRI, myself, and Nirma, we had a science congress in Ahmedabad for Dr. Ganguly. Now, this is not enough. This was just a beginning. At that time, I was not knowing Professor Ganguly is very close to our Modi Sahib. As all of you, those who are from the science fraternity know, that Indian Science Congress is inaugurated by President and attended by Prime Minister of India. And for this particular event, it has to be seen that Ahmedabad become one of the best hosts. And the whole thing was lying on my head and all our committee. The Ganguly Sahib, he told me that about 60 people, scientists from across the country and from outside, I will take care of him. I said, sir, how we are going to take care? Okay, I will talk to Modi. He will keep them near Gandhinagar and somebody near Dholka. So Rajiv, Modi Sahib is celebrating science from day one when he joined, when I know him. Because celebration of science is promoting all this activity, whether it is a scientific publication, conference, and last, this thing. And during this development of this MyCDX also, many times I have seen him a very aggressive mood. Doctor Sahib, you can do all these things. Give this injection. It will be converted into responsive tumor. Start it. But after all, the pace of science is always slow. One has to go by method, and that method I'm very happy that whosoever has prepared this small tube movie, it has made my all things very simple. In another 5-6 minutes, I will like to show you or go through the slideshow. Somebody can help me in getting out. It is here. So you know that what is Mycidex C is again a proud moment. Dr. Brahmachari, your mother died on 15th August. My mother also died on 15th August. And we all feel here a proud Indian when we have gone through all these things this evening. Every 4 seconds, one cancer patient is added in the community of the cancer patient. And whatever the treatment we are having at present, the four pillars, surgery, radiation therapy and chemotherapy. Surgery and chemotherapy, they are local. Chemotherapy is systemic. Immunotherapy, for many years we are talking, but in last 1 decade, it has come up in a big way. These are all these slides for patient understanding, downloaded from National Cancer Institute. It is my passion that whatever I can convey to my own patient and people. So the very simple thing, that what is the immunity and cancer? I am told that every day some 10,000 cancer cell-like mutated cells appear in the body, and they are taken by this fire brigade department of God Almighty. This, after all, immunity system is a fire brigade in the Canada. All we know that there is an elimination, there is equilibrium, and there is an escape. In cancer, it is an escape. So we want to go back to make it eliminable and to get the cure. This has also been shown here in the movie, that by reducing the tumor load, you are allowing this immunity system in the body to help and cooperate. So radiation, surgery and chemotherapy, they help synergistically with immunology. Again, this slide from NCI, which shows how the cancer and immunity correlate. The dendritic cell vaccine, lots of things are coming in the newspaper. Again, the cells are being monitored in such a way and given back to the body, and they produce the immune system. And this is what the milestones. Before 10 years, we were all talking about the new cytotoxic drugs coming in the market. For the last 10 years, everybody is talking about immunology, because it is there is a probably exhaustion of getting new idea in the cytotoxic. We have to now help the body to get rid of cancer cells. When the presentation comes, one go to Mr. Google Das and find out how many things are available or references are there. For any subject, it goes in lakhs. I try to find out that what is the immunotherapy in cancer is reported in last few months in the literature. The vaccination therapy, even for the early case coming up, the P53 related immunotherapy, then diagnostic. This is what the thing with the India can sell. It is desmocollin 3 and its prognostic effect in cancer. So I must congratulate my Indian community and my own people from Ahmedabad to come out with some biomarker on which we oncologists can plan cancer treatment. This is a Medscape last week that, in last two conference also, in Australia and in ESCO, last ESCO, there were lots of discussion on immunotherapy. And according to the one literature search, there are about 1,015 clinical trials going on in the field of immunotherapy of cancer. The Mycidex C, you know now, that is a immunomodulator, and there's lots of activity to make it a drug for choice in lung cancer, particularly squamous cell cancer. And those cells which are positive for this our desmocolin C, only those cells are being killed. So this drug is effective only when the cells express desmocolin C. I am happy to state that at Tata Memorial Hospital and at GCRI, this test is available. We can do and we can find out the positivity of desmocolin C in the tissue. What I want to convey that this particular markers, desmocolin C, the lots of literature have come up only last 2 years. Again, Gujarat wants to be number one. And here also, I convey Cadila and its dedicated team, congratulations to be number one for getting a orphan drug status for this Mycidex C. About 90, more than 90%, they are positive in squamous cell. This is something which is phenomenal. And if we can translate it into a therapeutic uses, and the evidence are there, because of that only the drug controller of India has given them to market this drug for this particular situation. Now, previously the IMUVAC was there, which was probably a previous version of Mycidex. I asked the Cadila team that give me a chart which shows difference between the BCG, which every one of us get after birth, and no problem, it gives lots of immunity. And again, Mycidex. There are few differences, it is a kill thing, and it is a kill thing with an immune enhancer without any toxicity. This is what the beauty of this drug is. Lung cancer, everybody know, is a very major healthcare problem in the country. And majority of them, they are in advanced stage. Even at GCRI, the number of cases who are offered surgery for lung cancer are less than 100. However, the number of lung cancer cases registered at my institute are more than 500. So most of them, they require some systemic treatment. And what I want to convey is that in last 7-8 years, we are talking lots of things about adenocarcinoma of the lung. Non-small cell cancer, there are two components, major adeno and the squamous. For adeno, we have got lots of drugs available, which are working at a molecular level. For squamous, we were not having anything. Now there is hope here. There is a small trial which explains the utility of Mycidex in lung cancer. The drugs which are commonly used for chemotherapy of lung cancer, they are given along with Mycidex. And a very simple scheme. Those oncologists who are sitting here, by reading this, they can say that they can try this thing if they are convinced about the utility of this drug. There was a good trial, and the toxicity, as far as the with Mycidex and without Mycidex, is not much. This is what, for my oncologist friend, I requested Cadila to prepare a special slide. Because this drug has to be given intradermal. I am told that now they have come out with a pre-filled syringe and a small needle. But the site of administration, one has to change. Because in my use, I found that if it is given repeatedly at a local site, it can produce a big blister and abscess. Now the response rate in a MySET exam, there are 3 patients who are a complete response. And there is a definite, for the first time when I was given this presentation at the Cadila headquarters, I requested community of scientists at Cadila that please come out with drug. Because in squamous cell carcinoma, I don't have anything to offer to the patient after the initial treatment. So conclusion, you have seen the movie, but there are 3 or 4 other cancers where these people have tried this and found to be useful. One is the invasive bladder cancer. Second is melanoma. Melanoma, all of us know that we were using BCT. Why not to be having the benefits of this in melanoma? And third is ovarian cancer. Oh. With this, I would like to conclude my talk. Anybody who is interested more in this particular drug and learn more about the immunological aspect of this particular medicine, Team Cadila and my good friend Dr. Khamar is there. He is an ophthalmologist associated with Cadila Group. But when he talks about immunology, I have to refer to the books. He has done a great job. Whole Cadila team has done a great job. Thank you. Thank you very much for associating with me for celebration of science, which I was part of celebration of science by Modi ji for more than 40 years. Thank you very much.
Good evening, and I think I'm very happy that we are now having one more mementorium in our hand to tackle the disease for which we have a very limited number of the effective therapeutic approaches. So I think the world as well as all of us will be really privileged to have the new molecule which will show the results. I am sure what we need to do in this situation is to do more clinical trials and really show in a way that we do our phase 3 trials to show that overall we can really improve or have the major impact. And I think this is very important. We have a large number of patients. Patients are no problem. And I'm sure the pharmaceutical industry as well as maybe the government will be very much interested in helping the oncologists to do more and more studies on the new molecules and show to the world that how this molecule can make a major impact in controlling this disease. So I think I would again request the pharmaceutical Cadila particularly and also the government to really have a combined force and run a huge clinical trial which can clearly show the data.
May I like to add one comment to this?
Yes.
With the spirit of giving affordable medicine, I was just very excited to talk about it. but this drug is at cost at 400 rupees per 1.1 ml. And they have calculated that if the person has to take the whole course, it will be only 40,000 rupees. That is the cost of the drug which helps in the adenocarcinoma as a molecular targeted drug around 40,000 rupees per month. So again, being made it affordable. What Dr. Advani says is very true. And as the people from the science are here, in many countries, the government take up the clinical trial. The company cannot have, they develop, but the clinical trial may be conducted by the government.
So with this, all of us are so grateful, and we thank the organizers for giving us this opportunity to be here and participate in such important moments of the introduction of the newer weapons against the cancer. Thank you very much.